Here at the Konstanz Clinic, a new method for correcting protruding ears has been developed, the so-called stitch method. It was devised by Dr. Waldemar Merck and, as an ear, nose and throat specialist, he's successfully operated with this method for years. Every case has been carefully recorded. The most impressive result is that no one, not even an expert, will be able to see afterwards that the ear once protruded and was operated on. We're going to show you two cases. 8-year-old Viva shortly before the operation with protruding ears, and 13-year-old Annika. Both have been assured that they will be able to return home immediately after the operation without bandages and dressings. Dr. Merck achieves this result using only needle and thread. My method dispenses with the cutting of skin. It dispenses with the exposure of cartilage behind the ear, and it dispenses with any reworking of the cartilage itself. It's minimally invasive. I pin the ear without a single incision by invisibly inserting threads under the skin and using stitches to create a new anthelix fold. That was 8-year-old Viva before the operation, and to show the difference, a week later, after the operation. Some years ago, Viva's mother had herself undergone an operation under the old method, so it's easy to make a comparison. First, we will look at Viva. Her anthelix fold shows no sharp edges and there are no visible scars. What we have now is a beautifully rounded anthelix fold. The ear is well positioned and after a week, it's hardly discoloured. There is some encrusted, dried blood where the stitches were made, but with normal washing they should fall off by themselves in the next few days. In contrast to this result, let us look at her mother's ears, which were operated on 10 years ago with the old method, the traditional method. An irregularly formed anthelix fold. The surface is also irregular, and although the ear no longer sticks out, the result, from a cosmetic point of view, is far from optimal. Now let us take a look at the other ear, and again we see an anthelix fold that's not optimally formed. It is irregular, and here at this point it's drawn in, and the whole surface area is uneven. The ear itself lies close enough to the head, but from a cosmetic viewpoint the result is also not optimal. On average, the operation lasts 45 minutes per ear and is therefore significantly shorter than with the traditional method. 13-year-old Annika was given a local anesthetic. Like all other patients, she enjoys the following advantages of the stitch method. Immediately after the operation, she can return home without dressings. Even during the operation, with mirror in hand, she was able to help determine the positioning of the ears. And later, she will see that her ears look absolutely natural and that no one can see that they once protruded and were operated on because there are no scars. A few more examples of satisfied patients. Before the operation, a year after the operation, 10 years after the operation. Here, a young girl who we photographed just one day after the operation to show that no dressing is necessary. Furthermore, you can see that one day after the operation, the ear is still slightly reddened, but this vanishes after 2 to 3 days. The next two examples show round, perfectly natural-looking anthelix folds that are regularly created with this new minimally invasive procedure because there is no working of the cartilage. And in contrast, here are two examples of anthelix folds with the traditional method, where the thinning of the cartilage results in sharp-edged anthelix folds, or a peaks and valleys landscape, or an irregular surface along the anthelix fold. These are alterations that cannot be corrected anymore, and under strict cosmetic standards can only be seen as disfigurements.